Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and happy American Thanksgiving to those of you who are listening today, November 23rd, 2023. I am going to film this and go off and do some cooking. But in any case, I had a cool case cross my path this week. This doctor showed me this case, and I learned about this obviously in dental school over 20 years ago, and I don't remember seeing a case over the last 20 years. And we were both looking at this tooth going, what the heck is going on? I can't show the picture of the actual tooth, so you're gonna have to Google this, but the word is dens evaginatus. Interesting name, Evaginatus, I think. So look that up. Take a moment to look that up, Google it, and see if you can kind of visualize what I'm talking about. The case I was looking at was an incisor, but basically the way it presented on the panoramic x-ray, and then also the PA x-ray that which she subsequently took. She took a few with shifts just to make sure it wasn't like a superimposed supernumerary tooth. There was clearly a tooth within a tooth, which is basically the definition of this, tooth within a tooth, like a full shaped tooth within a tooth, like a smaller tooth within that tooth. So it looked like a superimposed supernumerary tooth. You could see the lamina dura, you could see the pulp, everything like that. So we thought it was a supernumerary tooth that was just superimposed on it. But then as we started taking, she started taking PA x-rays from various shifts and various angles, it was still there. So then we were like, oh, maybe it's this. And that's what it was. She actually had it read. So let me tell you, and the question was, well, is there an ortho issue with this, was the question. And I was like, I don't know. I mean, no idea. Let me do a deep dive into the literature. So I found a piece of literature. This is a case report from the American Journal of Orthodontics, Dental, Facial Orthopedics, 2013, April 143.4 through 570/3, blah, blah, blah. Anyways, the title is Dens Evaginatus, the Hornet's Nest of Adolescent Orthodontics. And it is authored by John Turner and team. And in any case, I'm just going to read you the abstract, okay? So they're saying Dens Evaginatus is a rare dental anomaly. It's Thursday. The rare dental anomaly that occurs during tooth development and results in an abnormal protrusion from the occlusal surface of the affected tooth, often in the area of the central groove between the buccal and lingual cusps. Of clinical importance to the orthodontist is that these occlusal tubercles fracture easily and can be worn away, resulting in direct pulp exposure and a non-carious tooth. This can cause severe complications, including loss of tooth vitality, infection, abscess, cellulitis, osteomyelitis of jaw. I mean, it seems like, yeah. They said, be careful with your treatment planning, be careful with your moving and things like that. And so sometimes they say they recommend extracting it first. Sometimes they recommend not moving it. So it sounds like to me, like I would probably send that case to endo. And I think that's what my doctor is doing, just to have it looked at. But letting the parent know that there's a good chance this tooth may not survive treatment. Sometimes it's better just to preemptively remove it. Or if you're doing like an Invisalign or a clear correct or a clear aligner case, maybe theoretically you could lock that tooth, not move it, and build the whole treatment plan around it. And that's one of the beauties of how aligners work, assuming that's possible. So just something to keep into mind. I learned something kind of new that I hadn't seen in a while. So I just wanted to share it with you. All right, thanks.